One in three modern day Americans worry about affording healthcare, justifiably so, considering the United States is one of the only countries in the world that has a for-profit insurance system. So today we'll be delving into why our health insurance is so insanely expensive and also the consequences that come from those expenses. Let's dive in. So my question when I first thought of this topic to discuss was, what are we actually paying for each month with the hundreds and thousands of dollars? So to kick off this episode, I figured a little bit of a lighthearted video wouldn't hurt before we get into the dark details of the health insurance system.
Hi, I'd like to buy health insurance. Okay, do you want to pay more per month or less per month? Less, of course. The silver package then? Sure. That's $150 a month. I can go to any doctor? In network, yes. Any doctor in network. Yes, and it would be $110 per visit. That's on top of the $150? Yes, that's your copay. What's copay? $110. Now what does it mean? We pay some of the visit and you pay the rest. Okay, how can you pay more of the visit? You'll need the gold package. How much is that? $450 per month. Okay, and with this one you pay the whole visit. No, you still pay $75. But I'm paying like $300 more difference. Yes, you are. What if I break my leg? What if anything? Would you cover that? Well, that depends on your deductible. What's a deductible? It's an amount you have to reach out of pocket before we cover anything. How much do I have to reach? Silver $7,000 and gold $4,000. Okay, what if I get the gold package, break my leg, and the bill is $4,500? We cover $500. That's nothing. Then don't break your leg. What's the point of insurance? It's in case of emergencies so you don't go bankrupt. Breaking my leg isn't emergency? There's way worse. It's cheaper to die at this point. No, it's not.
So even though we're already spending hundreds of dollars, up to thousands, depending on your household size, on this insurance, we still have to pay both a copay and a deductible with the majority of plans. So not only is health insurance incredibly expensive, but it is also extremely complex. So complex that most modern day Americans don't have the time to fully invest in finding out which plan works best for them and their circumstances. And even though the federal fee that was associated with not having health insurance was lifted in 2018, other than 5 states, like the guy said in the video, what's even the point of health insurance? And the insurance agent responded, in case of emergency, so you don't go bankrupt. Why are we asking people in medical emergencies, or even people who just feel like they should go into the doctor, to be concerned about the amount that they will be paying? We are essentially too scared to go without at least decent insurance because, again, what if? During my research, I decided to do a little experiment to just see what the average plan would be without any personal details whatsoever. And I went on to healthcare.gov and found the following. This is without any kind of personal details whatsoever. And I'll remind you that this is the amount for the monthly premium, not including any kind of deductible or copay. And as it clearly explains right here, the bronze plan says you'll pay more when you get care, meaning your copay will be higher and your deductible will be high. But you're still paying $407 a month. And again, that's just an average. For what? And even with the gold plan, you may pay less when you get care, which again, if you're paying $583 a month, why do you have to pay anything at all? But you'll still have a deductible. It will be low, so that's nice. It should be, though, considering you're paying almost $600 a month for this health insurance plan. The average cost for health insurance premiums by family size is $477 for a 40-year-old. A couple is $954. One kid added is $1,230. A couple with 2 kids is $1,506. And a couple with 3 kids is $1,782. Again, these are averages, so some of these could be lower and some of these could be a lot higher. And even for an 18-year-old, the average premium per month is $324. Most modern day Americans have jobs and that they have their health insurance through their jobs. So they're definitely getting a better rate per month than if they were to just go straight to Marketplace, but it's still very high. And again, that's just for the monthly premium, not including the deductible that you have to reach out of pocket before the insurance will even cover anything. And over the last 2 decades, the average deductible for single coverage health insurance has more than tripled. And it will likely just continue to increase. So then if the United States spends more as a nation on healthcare than any other developed country, why do we have worse health outcomes? We're still lagging behind other countries by significant amounts in multiple health categories. So again, where is the money going? And why is health insurance so expensive? A few of the reasons I came across in my research is the introduction of new, innovative healthcare technology that can lead to better, more expensive procedures and products. In addition to the general complexity of the United States healthcare system, it's not just us modern day average Joes that don't understand the system. Even the people who are actually working in it think it's too complex, which leads to more time being dedicated to things that aren't necessary. And many healthcare centers are prioritizing profits over patients' care. But probably one of the most unfortunate reasons is something known as defensive medicine, or in layman's terms, unnecessary testing, scans, and procedures. And defensive medicine really only benefits the providers. Not only are they getting paid more, they're protecting themselves from any potential lawsuits. Now, this is not all medical providers. I have had some very, very good doctors over the years. But these scans, tests, and procedures, not only are they unnecessary, but they vary greatly in their price. Even the same exact procedure with the same machine in the same region. And if that doesn't tell you that this is solely for profit, not the patient, I don't know what will. And there are several unfortunate consequences due to this for-profit health insurance system. One of the most severe ones is those people who feel they can't afford the health care often put off going into the doctor, which can result in their death. And again, this is only increasing as the price of health insurance increases. The Institute of Medicine, using older studies, estimated that 1 American dies every 30 minutes from lack of health insurance. But David goes on to say, even this grim figure is an underestimate. Now, 1 dies every 12 minutes. And I know death is a part of life, but when we can prevent it, we should. Another consequence is likely the fact that less and less people are having kids, because the unfortunate reality is these insurance premiums only increase when you add people to your family. And just adding 1 kid increases the average premium for a couple to $1,230. And for responsible adults, finances are taken into consideration when we have kids, because we should want to give those children the best lives possible, which unfortunately nowadays includes health insurance. So unfortunately, in the United States, which prides itself on being the best at most things, we have evidence that we are nowhere close when it comes to our healthcare system and taking care of our people. And really the only resolution to this would be to somehow have the United States adopt the mindset of other countries who also privatize some of insurance, but not all of it, because healthcare should be a right, not a privilege. And that's all I've got for this episode. See you next week.